So we have a gentleman here. He's come for his 3-month review. So had his transplant done 12 weeks ago. So one of the aspects we do is just to see how the patient is, see how they're doing, see how they managed with the post-op care, how they feel like they're recovering. One aspect is to look at the donor area. There's another video where I've gone into a bit more detail about this, but essentially in the donor area, we're just looking to see, is it healed? Is there much in the way of scarring? FUE hair transplant are not scarless procedures, but most of the time, the scarring should not be very visible, if at all. So you can see here, nicely healed, no obvious hypopigmentation scarring marks where sometimes you might see some odd little white marks and things. So it's all looking nice and healthy. We always try and minimize scarring just through ensuring that we use appropriate size punches, not very large punches, to make sure that when we're harvesting, we don't take consecutive hairs. We don't take one, then another one, then another one, then another one. A clump of them, we take them sporadically, so that when the hair grows back, it should look pretty normal and it should look like nothing's been done. So we've asked and checked the donor area, so that's looking fine. We then check the transplanted area. So at 3 months, we might expect to see something like this. So we've got a few hairs coming through. It's all very fine, very thin at the moment, but there is some signs that hair's coming through. Interestingly, on this side, also some hair coming through, but not quite as much. And that's not too unusual to see that. So often we will see that one side seems to be growing in a little bit quicker. But I think the key thing to remember is at 3 months is that we're not really expecting too much in the way of growth. And the hairs that are there tend to be quite fine and quite thin and quite short. And over time, you will see that the hair gets thicker, gets longer. And at 3 months also, not all of the hairs will have come through yet. So there are still probably some follicles in the scalp that haven't yet had a hair shaft come through, so they're still not quite visible. So still very early days. Always at 3 months, I tend to try to reassure the patient and explain that yes, you might have a little bit of hair growth at this point, but it's still very early days, and actually most growth you're going to see between month 5 and month 8. So it's a bit of a waiting game. Have to hang tight and just sort of wait for more of the hair to come through. The 3-month review will also talk about other things, obviously deal with any queries, questions, concerns you may have, but also to discuss sort of preventative treatment, medications and things. So this gentleman has already had his 3 sessions of PRP, just having had his 3rd session last week, and also he's applying the spray, the finasteride and minoxidil, into the scalp in order to try and thicken the pre-existing area in the crown and elsewhere. And that pretty much is our 3-month review, looking at the donor area, making sure it's healed up nicely, checking to see where we are in terms of growth, discussing prevention, so medications, PRP, what have you, and of course answering any questions or queries you may have.